The big picture is that there is no federal policy without state policy. Like, where are we going to get the ideas if it isn't from our communities and our neighbors and the states we live in? I think one thing that's really important in oral health is also the tribal level, because so many tribal nations have made amazing advances in oral health. I think probably the best example is the dental therapy program that was started by the Alaska Native Tribal Health Consortium, spread to in the rest of Alaska, and then was adopted in Minnesota and now in lots of other places, including in Arizona. And those state laws really gain traction, both because of Indigenous advocacy and also because of demonstrations of effectiveness within sovereign tribal nations.
States really are often the place where there's sort of a testing ground for innovation, and innovative state policies are often the inroads to broader federal policies. I don't think we would have seen those broad federal changes happen without people from the state level sharing on the ground experience about the actual impact that was having on access to care. No one entity is ever going to be the expert on the context in every single state. And so hearing from state advocates and understanding what's important, what you're working on, it just really wouldn't be possible to do good federal advocacy without that. And so even from from an advocacy perspective, having that inroads into knowing what's going on in the different states and what's coming up from communities about what people need is really, really critical.